I'm Viet. I'm a physician assistant with Intermountain Heart Institute at Intermountain Healthcare, and I'm here to talk about our study, the St. Louis trial, which was really a trial on smartphone ECGs and whether or not we could get a comparable ECG reading to assess Stemi, ST elevation MIs, versus a standard 12-lead ECG. And so the background here is that we know that door-to-balloon time, especially in STEMIs, is very important, but it's all contingent on first medical contact in order to get into the hospital. So our thought here was to look at how we leverage wearables, mobile health, and health devices, and see if we can put that technology in the hands of patients to diagnose STEMI sooner. In this case, we partnered with AliveCor. The prototype used 2 clips, and what we did was we looked at chest pain as well as STEMI-activated patients. The chest pain group served as the control, and these were all folks that came in, had chest pain, and were in the emergency department, and so that way we could have a control group. Then our second group was the STEMI activated group, and what would happen is that the STEMI would be activated, and we would go and we would consent the patient and provide a 12-lead ECG standard, leave those same stickers on, and then complete a standardized 2-prong approach here and obtain a 12-lead. Those were then compiled together into a 12-lead, so to speak, EKG. And then we read those. We had 5 sites involved. The conclusion here was that as we obtained all of these EKGs, we had readers that then looked at them side by side for comparison, and then actually they read them also as a group without knowledge of one to the other, and were able to take a look and see if they could diagnose STEMI all by itself, and or of course provide a diagnosis of non-ST elevation MI. Now the quality was quite good actually in the majority of them. Some were called fair, and really 1% were poor. So some of the takeaways here: the current prototype using a prong approach we don't think is something that you could use in the general population. It was quite difficult, and in those sites where they did plenty of these ECGs by iPhone, we had a learning curve, and the EKGs were actually quite great from those sites. Those that did fewer, of course, that's where the majority of the poor EKGs came through. So in conclusion, what I would say is we now have shown that you can get an equivalent reading for ST elevation MI on a 12-lead EKG. It remains to be seen if we can get a prototype or hardware that will be patient-friendly and will pair up with the iPhone or with Android, with any smart devices, and be in the hands of patients.